If you've already been told to reduce inflammation, you've probably heard the usual advice: eat better, move more, cut the processed food, and look, none of that is wrong, but here's what almost nobody explains. After 60, inflammation doesn't just increase, it starts feeding itself. And for a lot of people, doing all the right things still isn't enough, because the game has changed in a way nobody warned them about. So here's what we're going to cover: what's happening inside your body after 60 that keeps inflammation elevated, including something about your own cells that's going to surprise you, and what the research says genuinely moves the needle at this stage of life. Let's get into it. Scientists actually have a name for what happens to inflammation as we age. It's called inflammaging, and I want to explain it properly because most people have heard the word inflammation, but they haven't heard this specific version explained in a way that makes the after 60 piece make sense. Here's how your immune system is supposed to work. Something goes wrong in the body, an infection, an injury, damaged tissue, and your immune system fires up. Inflammation kicks in, handles the problem, and then it turns off. Flare up, deal with it, stand down. After 60, the stand down part stops working the way it should. Your immune system stays in a low-level state of activation, even when there's nothing specific to fight. Not a big dramatic flare, just a slow, constant simmer, low-grade, chronic. And that persistent background inflammation is what researchers are calling inflammaging. This is the part most people have never had explained to them. Over the course of your life, your body accumulates what researchers call senescent cells. These are cells that have been damaged or worn out, they've stopped dividing, they can't do their jobs anymore. But they haven't died, they're just stuck there. And here's what makes them genuinely dangerous. They're not silent. They're constantly leaking inflammatory signals into the surrounding tissue. Some researchers have started calling them zombie cells. Honestly, the description fits. Not alive the way they're supposed to be, not gone, just sitting there, causing problems. Your immune system is supposed to clear those zombie cells out. When you're younger, it does, but as you get older, that cleanup job gets harder. So the zombie cells accumulate. More zombie cells means more inflammatory signals. More inflammatory signals accelerates the aging of healthy cells nearby, turning them into zombie cells too. You see where this is going. It's a cycle. Not just inflammation is higher, a loop that keeps driving itself upward. That's why after 60, it doesn't plateau. It keeps climbing. That's the piece that changes how you think about addressing it. So what does that translate to in terms of real health risk? Between ages 40 and 59, about 40% of Americans have cardiovascular disease. By 60, that number nearly doubles to 75%. And it doesn't stop there. Heart disease, dementia, type 2 diabetes, cancer, the top 10 conditions affecting people 65 and older are all closely tied to this same driver. After 65, the risk of Alzheimer's doubles every 5 years. I'm not saying that to alarm you. I'm saying it because those numbers have a driver, and when you know what the driver is, you can do something about it. The cycle can be interrupted, not with a supplement or some complicated protocol, with specific changes that work with this biology instead of against it. And the first place to start is food. I know, you've heard this. But the angle here is specific, and it's different from what most people are doing. I see this constantly. Someone is managing their diet, doing what they think are the right things, and they're still dealing with elevated inflammation markers, still fatigued, still dealing with that general low-grade feeling of something being off. And the reason is almost always the same. They're treating inflammation like a removal problem. Cut the bad stuff, add the good stuff, done. But after 60, that approach doesn't go far enough. Most people think about anti-inflammatory eating as removing things. Less sugar, less processed food, less alcohol. And yes, all of that matters, but what the research on inflammaging specifically shows is that it's not just about removing triggers, it's about actively supporting the mechanisms your body uses to regulate inflammation from the inside. What does that actually look like? A diverse range of plant foods, different vegetables, legumes, whole grains, nuts, olive oil, feeds the gut microbiome in a way that helps keep chronic inflammatory signaling in check. And most people over 60 have never been told this part. Gut diversity tends to decline with age, and as it does, the gut itself starts contributing to inflammatory output. Not just neutral, actively adding fuel to the cycle we just described. There was a large study, the Attica study, over 3,000 participants, that looked at exactly this. They measured how closely people followed a Mediterranean-style dietary pattern and then looked at their blood markers of inflammation. The people closest to that pattern had, on average, 20% lower CRP and 17% lower IL-6 compared to those furthest from it. These are the exact markers that drive the inflammaging cycle. Measurably lower, not a small margin. So what does that mean on a plate? Fatty fish first, salmon, mackerel, sardines 2 or 3 times a week, then more variety in your vegetables, not the same 2 or 3 on rotation. Olive oil as your primary fat rather than the alternatives. Legumes a few times a week. These aren't arbitrary recommendations. They're targeting the specific mechanisms that go wrong after 60. And this is the part that catches most people off guard. It's not just what you eat, it's how varied it is. Rotating your vegetables, mixing up your fiber sources, varying your proteins, because variety is what sustains microbial diversity in the gut. And that diversity is one of the regulators of how loud the inflammatory signal gets. Same healthy meals on the same rotation every week isn't the same as genuinely varied ones. That distinction matters more than most people realize. The second piece, and this one has the most direct impact on the specific mechanism we talked about, is movement. And there's something about exercise and inflammation that most people have completely backwards. Worth clearing up before anything else. If you've ever felt more sore, more inflamed, more run down after starting a new exercise routine, that's real, and there's a reason for it. Exercise causes a temporary spike in inflammatory markers while you're doing it. Your muscles are contracting, there's stress on the tissue, and the body fires up an acute response. That's normal. Actually, let me be more precise. It's not always comfortable, but it's expected, and it's part of how the body adapts. The problem is people feel that spike, decide exercise is making things worse, and stop. What the research shows is that it's the pattern, consistent movement over time, that drives inflammation down. Not any single session. The acute response is your body adapting. The long-term effect goes the other direction entirely. And this is the connection most people miss. Remember what we said about zombie cells. Senescent cells accumulating because your immune system can no longer clear them fast enough. Regular exercise is one of the most effective tools we have for improving that immune surveillance. Your body gets better at identifying and clearing those damaged cells, which means the self-reinforcing cycle, zombie cells, driving more inflammation creating more zombie cells, that cycle gets interrupted at the source. So check this out. A meta-analysis that pooled data from 40 studies, nearly 1,900 older adults, all aged 65 and up, found that exercise training significantly reduced CRP across every type of movement they tested. Aerobic resistance combined, all of them brought CRP down. CRP is the inflammation marker your doctor is most likely checking, and these reductions were consistent across the board. So what does that mean for you? You don't need to run, you don't need a gym. Walking counts, resistance bands count, swimming counts. The research on this population is genuinely forgiving about which type of movement you choose. What it's not forgiving about is consistency. Irregular movement doesn't produce the chronic adaptation. The anti-inflammatory effect builds over time. It requires showing up regularly. Aim for 30 minutes most days. If you're starting from nothing, start from nothing. 10 minutes is more than 0, and the body responds faster than most people expect once you're consistent. I want to say something directly before we move on, because I think it matters. I've seen people in their 60s, 70s, even 80s turn this around. People who got their markers tested, saw the numbers, made a decision to move consistently, and watched those numbers come down over months, not years, months. It is not too late. But I've also seen the other side, and this is the part I think about. 5 years from now, 10 years from now, this is how people end up watching from the sidelines. Not from one injury, not from one dramatic event, from 1,000 small decisions that quietly accumulated. Someone who used to walk the neighborhood every evening and gradually stopped. Someone who used to garden for hours on a Saturday morning and slowly found it too uncomfortable to stay on their feet. Someone who can't get down on the floor to play with their grandkids anymore and doesn't fully understand why, because nothing specific ever happened. It just accumulated. I've heard people say they wish someone had told them sooner. that they assumed the stiffness, the fatigue, the slow decline was just aging, just normal, just what happens. And by the time they realized it wasn't inevitable, some of what was lost was already gone. It doesn't have to go that way. The person who kept walking, who kept moving, who kept showing up, they're still gardening, still getting on the floor, still doing the things that matter to them. That's not luck. That's what this looks like when you catch it early enough. And for most people watching right now, early is still right now. So with that in mind, let's talk about the last piece, sleep. And I want to tie it back to the mechanism we've been building, because the connection here is more direct than most people realize. There was a study out of UCLA, 29 older adults, all between 61 and 86, where researchers measured what happened to inflammatory gene expression after just one night of partial sleep deprivation. Not total sleep loss, not a week of poor sleep, just restricted, cut off between 3 and 7 in the morning, one night. What they found was a significant activation of those same zombie cell pathways, the inflammatory signals that senescent cells leak when they accumulate. After one night of disrupted sleep, older adults showed patterns consistent with accelerated senescent cell activity. The cycle we've been talking about, the one that keeps driving inflammation higher, was being switched on by a single bad night's sleep. And it works the other way too. Consistently good sleep is one of the most powerful anti-inflammatory levers you have. Not glamorous, not a supplement, just sleep, consistently, enough of it, at roughly the same time each night. 7 to 8 hours is the target for most people. But here's what matters as much as the number: regularity. Going to bed and waking up at roughly the same time, even on weekends. Your body's stress hormone rhythm, which directly regulates inflammatory output, is anchored to that consistency. Disrupt it, and you disrupt the regulation. The two aren't separate things. I know what some of you are thinking, because I hear this constantly. I can't sleep. I wake up at 3 a.m. I've dealt with it for years. And I understand that sleep problems after 60 are genuinely common, and I'm not waving them away. But disrupted sleep making you more inflamed, and inflammation disrupting your sleep, that's another loop. And like the others we've talked about, it responds to the right kind of attention. Not always quickly, but it does respond, which leads to the last thing I want to say: food, movement, sleep. These aren't 3 random lifestyle tips. They're 3 angles of attack on the same mechanism, the self-reinforcing cycle that gets locked in after 60 and keeps pushing inflammation higher. And you don't need to tackle all 3 at once. Pick the one that feels most within reach right now. Get consistent with it, then add the next one. Because each one creates conditions that make the others easier. Better sleep improves exercise recovery. Better food supports sleep quality. More movement improves both. They reinforce each other, the same way the inflammation cycle reinforced itself, except now in the right direction. You have more leverage here than you probably think. One practical step before I go: if you haven't had your inflammation markers checked, ask your doctor about CRP and IL-6. Simple blood tests, often included in standard panels. Knowing your baseline gives you something concrete to track as you make changes. And changes do show up in those numbers. That's what the research keeps demonstrating. All right, if this gave you a way of thinking about this that you didn't have before, subscribe so you don't miss what's coming next. Drop your questions in the comments. I read them. Take care of yourself.